How many people in the UK are going to die in the months ahead before the government takes strong measures to deal with this virus? Where is the nation headed if it does not commit to stronger measures to make up for the valuable time it lost earlier in this pandemic as it entertained the idea of achieving herd immunity? This video mathematically models the spread of this virus based on published data that is freely available in the public domain. It compares the number of deaths in the UK with those in Australia. And the data can be found at this website here. And this is a website that collects information from governments. So it uses government's own published data to develop its statistics. It is a reliable source. All right, now if we have a look here, there's a picture from the Daily Mail of international arrivals at Heathrow who are not subject to any health checks, no temperature checks, no questions about Covid-19 or the places they've visited. They're just coming in and no medical checks whatsoever. And contrast that with the case in Australia where all international arrivals are quarantined for 2 weeks in hotels paid for by the taxpayer before they're released into the community. Bit of a difference between the two, and as we'll see later on, there's a difference too in the outcomes for the two nations in terms of the death rate. All right, so the cumulative number of deaths are recorded each day. The first recorded case of infection was on the 31st of January, so I've started at that point. The first death doesn't occur until the 5th of March, day 35, and one death there, and then thereafter grows, continually becoming larger and larger until, as of the 21st of April, total number of published deaths was 17,337. I'm making this video on the 22nd of April. There's also some concern about these numbers too. They may possibly underestimate the real number of deaths because it's suspected that maybe not all deaths from aged care facilities and from private homes have been recorded. There may be many people dying in aged care facilities and in private homes who are not recorded in these data. In this data. Graphically, the data looks like this, and you can see the exponential effect growth in the number of deaths just over the period given. Again, the data comes from this website, and it collects data published by governments across the world. All right. What we can do is we can fit a mathematical model to this data for the purposes of making predictions, what will happen in the future. We have data up to and including this point here, which is the 21st of April. What happens beyond that? And we need a mathematical model for that. And for that, we can use a mathematics package or a statistics package. And when we do that, the actual model that we come up with is this one here, this number by this to the power of t minus 1. T is the number of days since January, 31st of January, and P is the number of deaths. So how well does this model fit the data? Early on, you can see that the model here in this column, the final column, overestimates the actual deaths. And that's the limitation in this fitting of models. Later on, it catches up, and you can see, for instance, by the even by the 5th of April, the model is underestimating the actual published numbers a little bit. Same with the 4th of April. Carry on down somewhat, and eventually it does the predicted values from this model overtakes the actual data value. So it swaps in and out, sometimes underestimating, sometimes overestimating. So the final column here are the predicted values from the model I've just shown you, and this column here, the third column, is the actual published values as recorded on the website I've mentioned earlier. Just coming back to the graph again, you can see here the model overestimates. The blue line here is the graph of the model that overestimates the actual published data, whereas here the model underestimates the actual values, and the actual values are these red dots. They're the published values. So this is the model of best fit. You can do this with a mathematics package or a statistics package. So how does this model work? All right, well, this here is called the base, and we're going to look at the role of the base. So here's the value for the 18th of April. There were 15,464 deaths as published by the government. The model predicts 15,209. This 0.75, I've included the decimals only for mathematical completeness, so that any member of the public can take out their calculator and check all the calculations I've done on this page for themselves and see that they produce the same numbers. But strictly speaking, there's no such thing as 0.75 of a case of coronavirus. You can't have 0.7513 of a human being. So we would take this as 15,209 cases. Okay, so that's the 18th of April. The 19th of April, the model predicts 16,649, point this business over here. The actual published value was, for that day, 16,060. So how does this work? Well, if you take this base value here, this base number, and you multiply it by the value for the 18th of April, you'll get the value for the 19th of April, the predicted value for the 19th of April. So I take the predicted value for the 18th of April, multiply it by this base, here it is, and I'll get the predicted value for the 19th of April, this one here. And that means that the predicted value for the 19th of April is 9.463% larger than the predicted value for the day before on the 18th. Or 9.463% of the value for the predicted value for the 18th of April is 0.09463 times the value for the 18th of April, the predicted value, that's this value here. And you get this number here, 1,439.3. And if I add that to the predicted value for the 18th of April, I'll get the next day's value, the predicted value for the 19th of April. A little bit of rounding here, hence the 0.1 instead of 0.0501. Now, all of the above means that the daily rate of growth in the number of deaths in the UK as of the 21st of April when I'm putting this model together, due to this virus, is 9.463% per day. So the number of deaths each day is 9.463% greater than the day before, at least for this model. Right, so how many deaths does this model predict in the days ahead? Well, okay, so the 22nd, and that's today, I'm making the video on the 22nd, it predicts 21,836 deaths. If we carry on down, 1st of May, 49,271. Keep going down, and we will come to over here, if I keep going down to the 30th of May, we have 678,188 deaths. Keep going down further until we come to the 4th of June, and we have here 1,065,828 deaths. So by the 4th of June, we've passed the 1 million mark, total number of deaths, which is not far away. The 4th of June is not far away at all, just some weeks away, and we're going to cross the 1 million mark. If the trend that has been evidence right up until yesterday, the 21st of April, if that trend continues, then the 4th of June should see the 1 million mark crossed in terms of deaths due to this virus. If we keep going further, the 11th of June, with exponential growth the way it is, we cross the 2 million mark. They're staggering numbers. But if the pattern as of the 21st of April continues, this is what we can expect to see around these figures. Right, put that in perspective, the total number of military and civilian deaths in the UK during World War I was, according to this website, 994,138. That's military and civilian deaths. According to this model, the number of deaths due to COVID-19 occurs just before the 4th of June, day 126, and that's where we cross the 1 million mark on day 126. Now, day 126 was the first day of infection. About a month later, the first death occurs. So really, in the space of about 3 and a bit months, you've crossed the 1 million mark in terms of death, and that's just the exponential nature of growth. This virus, the number of infections grows exponentially, and the number of deaths grows exponentially, as I've shown you on the graph on the previous day. So that model predicts the UK will lose the virus in just over 4 months, the same number of people lost in the whole 4 years of World War One. That should be a 1 there, sorry. In 4 months, this virus has done more damage than the First World War in terms of loss of life, which is truly staggering when you think about it. So how does the UK compare with Australia? Well, early on in the pandemic, Australia appeared to adopt the idea of achieving herd immunity in some sort of controlled way. Fortunately, gave up the idea around the same time the UK did, if not a little bit before, and then proceeded to lock down the community very quickly after that. Also, Australia has a lower population density, and so social isolation can work more effectively there than perhaps in the UK, but nonetheless, the various state governments here were very quick, and the federal government, to lock this country down. The UK hasn't fully locked down its borders, as I showed you at the start of the video with the picture there. People arriving there in the UK are not being tested, not having temperature tested, and not being isolated. The UK hasn't fully locked down its borders and does not have enough testing kits to determine what is happening within its borders. Another factor too, some of the successful countries like Singapore, Taiwan, and South Korea have done extensive testing to find out where the virus is, and then contact tracing and also isolation of people affected and their contacts. And so they've been able to keep the numbers of infection down and the death rate they've been able to keep down. But you can't do that without a lot of testing. And there just doesn't seem to be in the UK enough testing kits. All right, so the UK, the population, 67,886,011. Again, taken today from this website. Number of confirmed cases as of the 21st of April is 129,044. Number of deaths, as I pointed out earlier, 17,337. Now, contrast that with a country like Australia, 24.5 million. Just over a third of just over a third of the UK's population, yet the number of confirmed cases as of the 21st of April is 6,645. Number of deaths is 71. Stark difference between this and this. Even if I multiply this by 3, it's still well less than this value here. So the UK really needs to have a look at what it's doing. The British government needs to get stuck in, lock the country down, start testing more widely. All right, now the concept of herd immunity in the form embraced early on in this pandemic by the UK is now a discredited idea. As an example, Dr. William Hager, I hope I pronounced his name correctly, a professor of the evolution and epidemiology of infectious disease at Harvard, wrote in The Guardian that such a policy would result in large numbers of people dying. And the evidence is starting to come in that he is correct in saying that. And the NHS would be overwhelmed. He reflected the general bafflement among many experts because herd immunity is typically achieved via widespread vaccination against the disease. There's no vaccine for COVID-19, so how can you talk about herd immunity? So no vaccine, and herd immunity without a vaccine assumes that the vast majority of people who recover from the coronavirus will then be immune. Well, that's not yet been conclusively established. Who knows how this virus works? How can you just plunge in and get yourself infected and allow large numbers of people to become infected when you don't even understand how the virus works? Does it act like the common cold virus, for which there's no vaccine? Does it act like the AIDS virus, again, for which there's no vaccine? There are vaccines for the flu strains, but they only last for so long, maybe 12 months. Is it the same with this one? Will this vaccine only last 12 months or less? Nobody knows. So how could people rush in and allow themselves to become infected in the name of achieving some form of herd immunity which is a misunderstanding of the concept anyway, and yet there's no vaccine. How can people do that? How can governments allow that? That's ridiculous. All right. So come on, Britain, you can do better than this. Get stuck in, lock the community down, check all foreigners coming in, increase the number of test kits, and start testing widely, as the World Health Organization has recommended. Test, test, test.